So one of the coolest things about working on the emergency response was that we were able to do something really different and improve the way that the community experiences the services we're providing, because we were doing something collaborative and innovative and brand new, and we had to work together really closely in different configurations than we typically would.
I think we improved the community's experience with the services and supports by building on the long-standing partnerships that we've had with community organizations over the years.
By managing outbreaks and providing guidance on quarantine and or isolation protocols for long-term care staff and residents. So I was with the long-term care facilities outbreak team during my deployment, and LTCF residents are one of the most vulnerable population that's severely affected by COVID-19 virus.
I was really impressed and awed by how public health pulled together an entire system that didn't exist before. So during the time I was deployed, I got to see how, from the ground up, there was a whole department for contact tracing that was staffed, and there was leadership, that there was PPE provision, that there were public service announcements for workplaces and schools, and testing sites for tests that hadn't even existed a few months before.
The Special Projects Office has been working with the Public Health Department to issue and manage procurements and contracts for COVID response services, including testing and lab processing, contact tracing and contact investigation, as well as vaccination services. While the Special Projects Office develops and manages the procurements and contracts, our public health counterparts oversee vendor relationships, contractor performance, and approve invoices.
Public health primarily. Public health was creating a lot of regulation about food facilities as well as swimming pools, what they needed to do for COVID, all the different pieces that they had to have in place.
So really the power within our team and within Healthcare Services Agency collectively coming together. In the early days of the response, there was just such beautiful, tremendous collaboration across county departments, really listening, understanding, and making sure that we were really meeting the collective needs of our homeless population.
The cool thing about the emergency response was that a lot of the titles and silos were just completely wiped away, and people were just doing whatever work was needing to be done. And so there were people who I had never met before, who I had never encountered before, who suddenly I was, shoulder to shoulder with, even if it was over a screen, in the trenches getting stuff done.
One is the communication. I thought that the county did a great job at communication. I think that this sort of a model of having a dedicated, the web page, the videos, the weekly meetings, that really made me feel connected.
The structures that we set up through the incident command system and the way that we structured our COVID response allowed us to leverage all of the strengths. I saw that most profoundly within Healthcare Services Agency. There were things that we needed to do that sat in all parts of healthcare services. And because of the way we chose to structure our response, we were able to easily access the things that we needed to serve the community.
I think we learned a lot about how information gets developed and managed, and we do need to carry that forward. We did not have, as we began, the infrastructure that really worked with data scientists and data engineers. I would like to see that get carried forward. I would also like to see the work that has been done in communications to really develop a true communications office. I would like to see that continue. Those are the two main places that I would like to see our work get carried forward.
I think this has been an extraordinary experience to be able to redo and rethink workflows and processes and figure out how to get things done in an efficient manner and having fun doing it.